abnormal breathing and their pathophysiology. In previous sessions, I have discussed about the mechanism, that is neural regulatory mechanism of respirations, and we also discussed about the chemical regulation of respirations. But today's lectures is little bit different from previous lectures. So here in these lectures, I am going to discuss about the Asphyxia Cyanosis, then Hypoxia, Dyspnea. So these are some terminology. In today's lectures, I am going to discuss mainly the pathophysiology of all those terminology, right? Let's start with the very common terminology, that is hypoxia. So what is the physiological basis of hypoxia? It is nothing. It is defined as a lack of oxygen at tissue level. A very important point. If you see the level of oxygen at the tissue, so there is a deficiency of oxygen at the tissue level in hypoxia. This hypoxia can be classified into 4 different types, and the characteristics of all the 4 different types of hypoxia are of different. So what are the most important features of all those 4 different types of hypoxia? So the types are hypoxic hypoxia, anemic hypoxia, stagnant hypoxia, which is also known as ischemic hypoxia, and finally histotoxic hypoxia. I explain in details of all those hypoxia types. I will also discuss about the pathophysiology of all those hypoxia types. If you compare the terms hypoxia with anoxia, you will find some differences. So what is the main difference between hypoxia and anoxia? Here difference is, in case of anoxia, there is a complete absence of oxygen in the tissue level. But in hypoxia, there is a deficiency of oxygen at tissue level. So it means there is a difference between hypoxia and anoxia. Now, what are the pathophysiology of different type of hypoxia? The first one is called hypoxic hypoxia. So what is the features of hypoxic hypoxia? The features is, if you see the arterial oxygen concentration in hypoxic hypoxia, this is not normal. Means the arterial partial oxygen pressure is less than normal. That is why it is mentioned here, low arterial oxygen. This is the most important features of hypoxic hypoxia, right? If you see the causes of hypoxic hypoxia, there are many causes. Like high altitude. We know in high altitude, the partial pressures of gases is less, right? And even if you see the partial pressure of oxygen in high altitude, there is a less partial pressure of oxygen, right? So if there is a less partial pressure of oxygen, or if the atmospheric oxygen concentrations in high altitude is less, so obviously during inhalations we will be able to inhale less amount of oxygen, right? Because in high altitude the partial pressures of gases is less, right? So here high altitude is one common cause of hypoxic hypoxia. Other than this, obviously there are different type of respiratory disorders, right? So what are those disorders? Like chronic obstructive pulmonary disease, acute respiratory distress syndrome, then pneumonia. These are the most common respiratory disease which affects the arterial oxygen concentrations, right? Other than this, hypoventilation, right? Hypoventilation is again another important causes of hypoxic hypoxia. Now, if you see the pathophysiology of hypoxic hypoxia, the most important thing is low oxygen in inspired air, right? This is the most important things that leads to decrease in arterial oxygen concentration, right? Other than this, in some cases, there is an impaired oxygenation of lungs. So if there is a low oxygen in inspired air, so obviously there will be a low partial pressure of oxygen in arteries, right? So if there is a low arterial partial pressure of oxygen, obviously it will affect the delivery of oxygen at tissue level. So there is a decreased oxygen delivery at tissue. So what I have mentioned here in the hypoxia definitions, I have mentioned there is a deficiency of oxygen at tissue level. So you can see here there is a decrease in oxygen delivery to tissue, right? Now, what are the different clinical features that is related with the hypoxic hypoxia? Yes, these are some clinical features like cyanosis. I will explain in details. Dyspnea, tachypnea, and respiratory distress. So these are some clinical features that are related with the hypoxic hypoxia. Now see, in case of second one, that is anemic hypoxia, here most important thing is low oxygen carrying capacity. It means in previous case I have mentioned there is a low partial pressure of oxygen, but here it is low oxygen carrying capacity. As you know, the oxygen carrying capacity depends on the availability of sufficient number of hemoglobin and availability of normal hemoglobin, because hemoglobin is the only molecule that carries the oxygen. So but here in case of anemic hypoxia, what we have seen, so reduced hemoglobin. So due to the reduction in hemoglobin concentrations, it directly affects the carrying capacity of oxygen, right? So there is a high chances of anemia in anemic hypoxia. So similarly, you can see in some cases due to the abnormal hemoglobin function also affects the oxygen carrying capacity. But here, though there is a decrease in oxygen carrying capacity, but the partial pressure of oxygen in artery is normal, right? But only things that is altered here is low oxygen carrying capacity, and it is only due to the reduced hemoglobin molecule. So you can see here normal PaO2 but reduced oxygen transport and tissue, ultimately tissue hypoxia. So what are the clinical features of anemic hypoxia? These are some clinical features, that is fatigue, dizziness and tachycardia. Now see the third one, that is the stagnant hypoxia, which is also known as circulatory hypoxia or ischemic hypoxia. So what is the features of this stagnant hypoxia? The features is poor perfusion. So as I already mentioned in definition of perfusion, it is nothing, it is the flow of blood, right? Perfusion means the flow of blood. So to get the sufficient amount of oxygen by particular cells, it needs proper supply of blood, right? Proper flow of blood. But here in case of stagnant hypoxia, what we have seen, there is a poor perfusion, means flow of blood is not proper, not sufficient. You can see what are the most important causes of poor perfusion. This is due to hypovolemic shock or cardiogenic shock. Other than shock, heart failure and arterial obstructions, and even in some cases a venous stasis that affects the normal flow of blood, right? You can see in the pathophysiology sections, here in stagnant hypoxia, oxygenation is normal, right? Means partial pressure of oxygen in artery is normal, but inadequate blood flow. Due to inadequate blood flow, obviously there will be a decreased amount of oxygen delivery at tissue level, right? So what are the clinical features? Clinical features are cyanosis, low blood pressures and slow capillary refill. So these are the most important characteristic features of stagnant hypoxia. Now the fourth one called histotoxic hypoxia. So what is the features? Features is impaired oxygen utilization. What is the meaning of this? Meaning is in this case also the partial pressure of oxygen in arteries is normal, the flow of blood is also normal, right? And oxygen reaches to the tissue, but there is some complications in tissue level. Tissues are unable to utilize those oxygen that is reached to the tissue, right? So that is why I mentioned here impaired oxygen utilization, right? You can see from pathophysiology section, normal oxygen delivery, but failure of cells to utilize it due to mitochondrial dysfunction. Yes, due to mitochondrial dysfunctions. Why? What is the main causes of mitochondrial dysfunction here? As we know, mitochondria act as a site for cellular respiration, right? In electron transport chain, what we have seen, there are some chemicals which affect the transport of electron, right? So here, the most important things, that is cyanide. Cyanide affects our electron transport chain, and electron transport chains are very much essential to generate the energy, right? So here in this particular hypoxia, what we have seen, there is a mitochondrial dysfunction. So what is the cause of mitochondrial dysfunction? It is due to cyanide poisoning or mitochondrial disorder, right? Now what are the clinical features? Normal partial pressure of oxygen, but lactic acidosis, right? Means as the functions of cells are altered, right? Due to changes in H+ and concentrations. So here you can see the clinical features contains the lactic acidosis, and even in some cases altered mental status may happen. So these are most important features of 4 different type of hypoxia. Now if I summarize this hypoxia, we can summarize in this way. Hypoxia occurs when there is an inadequate oxygen supply to the tissue, and there is a compensatory mechanisms, and compensatory mechanisms is very much essential to maintain the balance. So what are the compensatory mechanisms? There is an increased respiratory rate, that is called as tachypnea, and heart rate, that is tachycardia, and even red blood cell production also enhances to maintain the oxygen delivery, right? If hypoxia persists, there is a cellular dysfunction, right? And it leads to reduced ATP production, as I already mentioned, and also there is a shift of anaerobic metabolism. So due to anaerobic metabolisms, there is a accumulation of lactic acid, ultimately leads to the metabolic acidosis, right? And at the same time, as oxygen deprivation continues, so what is the negative impact of continuous deprivation of oxygen? There is a organ damage may happens that affects the mainly 3 different parts: brains, heart, as well as lungs. Means 3 most important organs may damage due to continuous deprivation of oxygen. And prolonged or severe hypoxia leads to multi-organ failure, and if untreated, it becomes irreversible and ultimately leads to the death. So this is what is the importance of the maintaining of sufficient oxygen level at tissue, and what is the importance of having a normal amount of blood hemoglobin, what is the importance of normal perfusion, right? Now see another important breathing or difficulties, that is called cyanosis. So what is the characteristics of cyanosis? You can see from the definition, cyanosis is nothing. It is a bluish discolorations of the skin as well as the mucous membrane, and in some cases an extremities also, right? So what is the causes of bluish discoloration? The causes is increased concentration of deoxygenated hemoglobin. So very important points of cyanosis. In cyanosis, there is a increased concentration of deoxygenated, that is deoxygenated hemoglobin. So what is the concentration of that deoxygenated hemoglobin? It must be greater than 5 gram per deciliter, right? So what is the impacts of this cyanosis? Or if there is deoxygenated hemoglobin in blood, so it leads to impaired oxygen delivery to the tissue. So again, there is a impaired oxygen delivery to the tissue level. If you see the cyanosis can be classified into two types based on some spatial characteristics. So what are the types and what are the characteristics? Cyanosis are mainly a central cyanosis and peripheral cyanosis. So how can we differentiate the central cyanosis from peripheral? You can say in case of central cyanosis, due to lung and cardiac disorders, there is a systemic arterial desaturation. A very important point of central cyanosis. Say due to the disorders in lung or disorders in cardiac systems, there is a systemic arterial desaturation. A very important characteristic features. So how can we differentiate from peripheral? In case of peripheral cyanosis, you can say there is a reduced oxygen delivery, right? There is a reduced oxygen delivery and it is due to poor circulation. Again, due to poor circulation, there is a reduced oxygen delivery. Not only this, it also increases the oxygen extraction in tissue. So these are the two important features based on which we can differentiate the peripheral cyanosis from central. Now, what are the most important causes of both the central and peripheral cyanosis? Say, in both the central and peripheral cyanosis, there are some disorders that are related with both the central and peripheral cyanosis. So, what are those disorders? If you see the disorders, some are respiratory disorders or disease, some are cardiac disorders, and some are the abnormalities in hemoglobin structures. It means all these things are related with the developments of central cyanosis. Now, what are the most important type of respiratory disorders that leads to the central cyanosis? These are again chronic obstructive pulmonary disease, pneumonia, and pulmonary embolisms, along with acute respiratory distress syndrome, and even high altitude also leads to the developments of the central cyanosis. Now, in case of cardiac disorders, you can see right to left shunts. Right to left shunts means there is a flow of blood from right side of the heart to left side directly, right? So this is called right to left shunts. Here right to left shunts is an important cardiac disorders. Along with this, congenital heart defects, right? That is also a cardiac disorders. Both the cardiac disorders affects the developments of the central cyanosis. In some cases, you will find methemoglobinemia and sulfhemoglobinemia. So these are not the normal conditions. Here, methemoglobinemia is a condition which prevents the normal binding of hemoglobin, which reduces the affinity between oxygen and hemoglobins. So here means methemoglobinemia affects the normal oxygen carrying capacity, right? So due to the less oxygen carrying capacity, there is a high chances of deprivations of oxygen at tissue level. So here both the conditions along with some abnormal hemoglobin variants are responsible for the central cyanosis. Now see, in case of peripheral cyanosis, the most important thing is the constrictions of the blood vessels, right? So as I mentioned in previous slide, in case of peripheral cyanosis, there is a reduced oxygen delivery due to poor circulation. Means for the proper circulations, it needs the blood vessels which has the capacity to carry sufficient amount of blood. But here, in case of peripheral cyanosis, there is a reduced oxygen delivery due to poor circulations. Now see, here what is the most important causes? The most important causes is vasoconstrictions, right? Along with this, circulatory failures is also involved with the developments of this peripheral cyanosis, and even in some cases hypovolemic shock or hypovolemia is responsible for this. Now, venous obstructions mainly deep vein thrombosis, right? If there is a thrombosis in the vein, that also affects the proper flow of blood, right? Proper circulations, that leads to the developments of peripheral cyanosis. Now see, if you see the most important characteristic features of the cyanosis, you can express by using the pathophysiology of cyanosis. Here, see, there is a decreased oxygenation of blood that is found in central cyanosis. Whereas there is a reduced peripheral circulations that is found in peripheral cyanosis. Both the case leads to the development of hypoxia, means there is a deprivation or deficiency of oxygen at the tissue level due to both the central cyanosis as well as the peripheral cyanosis. Now, another important feature is accumulation of deoxygenated hemoglobin, as I have already mentioned. Here you have to remember the concentrations in case of cyanosis, right? The concentrations must be greater than 5 gram per deciliter of blood. In some cases, like in severe anemia, subjects may have the blood hemoglobin levels is less than 5 or less than 4. So those whose blood hemoglobin is less than 4 or less than 5, though they are anemic, but they are not cyanotic, right? Because what is the concentrations or what is the amounts of deoxyhemoglobins for the cyanotic subjects? This must be greater than 5 gram per deciliter, right? In case of central cyanosis, if you see the percent saturation of oxygen, right, this is reduced, right? Whereas partial pressure of oxygen also reduced, right, in case of central cyanosis, and that ultimately leads to the low systemic oxygenation. So here you can see the important features of central cyanosis: reduced percent saturation of oxygen, that is less than 85%, and reduced partial pressure of arterial oxygen, right? And most important site that is affected by central cyanosis are lips, tongue and mucous membrane. How it is different from peripheral? Now it is different from peripheral. See here, in case of peripheral cyanosis, percent saturation of oxygen is normal here. Means hemoglobin carries sufficient amount of oxygen, right? Similarly, partial pressure of arterial oxygen is also normal, right? Means both are normal, but there is a sluggish circulation, right, that increases oxygen extraction, right? So this is the important features here, and by these features you can differentiate the central cyanosis from peripheral cyanosis, right? And even another important features by which you can differentiate: in case of peripheral cyanosis, the site of affected side are periphery or extremities, mainly the fingers, toes and nail beds, right? What are the compensatory mechanisms of cyanosis? See, hyperventilations. Yes, hyperventilations is very important here as a compensatory mechanisms, because it helps to increase the oxygen intake, right? As we have already seen, in cyanosis also cells are having some oxygen deprivation. So to get the sufficient oxygen, it needs to hyperventilations. It is a compensatory mechanisms. And increased cardiac output. Obviously, increased cardiac output also related with the sufficient supply of oxygen at tissue level. And even erythropoietin release to boost RBC productions in chronic cases. Yes, these are some compensatory mechanisms why this we can improve the level of the deficiency of oxygen at tissue level. Now, if you see the complications of cyanosis, there is a tissue hypoxia. The most important type of tissue that is affected by cyanosis or the tissue hypoxia that occurs are mainly the brain tissue, the heart tissue as well as the lung tissue. So if there is a hypoxia in the lung tissue or brain tissue or heart tissue, there may be developments of complications like coma, then arrhythmia or ischemia, and even there is a respiratory failure. Another important complications of cyanosis is polycythemia, right? So what is the features of polycythemia? It is nothing. It is the increased RBC productions in chronic hypoxia, right? And causing increased blood viscosity. So due to the increased amount of RBC productions, there is a changes in the viscosity of the blood, right? Increase in the blood viscosity. So due to increase in blood viscosity, there is a poor circulation. So it means viscosity directly or negatively impacts the circulatory rate. which raises the risk of thrombosis, and if there is a thrombosis, that maybe there is a high chances of the stroke. And even some cases, clubbing of fingers is common. So here it is seen in chronic hypoxia, and it is due to prolonged oxygen deprivations. So these three are the most important type of complications that are related with the cyanosis. Another important difficulties in breathing or breathing abnormality is dyspnea. So what is the features of this? See here, in this particular case, it is nothing, it is the shortness of breath, right? It is the shortness of breath. So here, due to the shortness of breath, there is an imbalance between the oxygen demand and oxygen supply. So as you know, for cellular respiration or to produce the for the metabolic activities, cell needs sufficient oxygen supply. Also, it needs the removal of carbon dioxide waste materials. But here in this particular breathing abnormality, you will find some imbalance. So what is the imbalance here? It is the imbalance between oxygen demand and the oxygen supply, right? So the most important site that is affected due to the imbalance of oxygen demand and oxygen supply is the respiratory system, cardiovascular system, as well as the nervous systems. Three major systems of our body are affected due to the imbalance between demand of oxygen and supply of oxygen. Now, what is the mechanisms of dyspnea here? See, as I already mentioned, in our regulatory process of respiration, there are some rules of chemoreceptors, right? They are very much sensitive to changes in the chemical compositions, mainly changes in the oxygen concentrations and changes in carbon dioxide amounts. So here, it is primarily triggered by chemoreceptors, right? And it is in response to hypoxia. It means when there is a low level of arterial oxygen, there is a changes in the functional property of chemoreceptors, and even due to hypercapnia or metabolic acidosis. Not only chemoreceptors, mechanoreceptors also triggered due to this reason, right? And both the receptors send some signals. So what is the site into which the receptors send the signals to improve the ventilations? The site is medullary respiratory centers. I have already mentioned. In the medullary respiratory centers, there are two such: dorsal respiratory group and ventral respiratory groups. So to get the stimulus, it needs to activations of those chemoreceptors. The activation depends on some conditions. The conditions here are hypoxia, hypercapnia, and metabolic acidosis. Along with this, there are some receptors called mechanoreceptors, and they got stimulations and due to under certain conditions. Now, in pulmonary disorders like COPD, again pneumonia and interstitial lung disease, pulmonary embolisms, there is impaired gas exchange. So if there is impaired gas exchange, it means there is no proper exchange of both the oxygen and carbon dioxide in between lung alveoli and blood capillary, as well as there is no proper exchange in between the blood capillary and tissue, right? So here, due to impaired gas exchange, it leads to hypoxemia, right? So what is the features of hypoxemia? Here it is low oxygen levels in the blood. Not only this, due to impaired gas exchange, it develops hypercapnia and ventilation perfusion mismatch. Now we can say in dyspnea, these things are common, right? These things, and all these things are mainly due to the impaired gas exchange, because we know the proper gas exchange helps to maintain the sufficient amount of oxygen at tissue level. Proper gas exchange helps, and proper perfusions helps to maintain the proper flow of blood, means circulation. At the same time, and another important thing is proper gas exchange helps to wash out the extra amount of carbon dioxide. So all these things are impaired due to impaired gas exchange that are related with this abnormal breathing process. Now, as all these things are altered, so to get the normal conditions, our respiratory systems need to take some initiative called as respiratory drive, right? So these respiratory drives are nothing. Due to these respiratory drives, there is a shortness of breathing or distress sensation, right? Means rapid breathing process. Now, there are some other conditions that are also related with this, like obstructive airway disease and restrictive airway disease. In both the case, airflow limitations occurs, air trappings as well as increased airway resistance that making exhalations difficult and increasing the work of breathing, right? So what is the most important features of obstructive airway disease and how it is related to the dyspnea? So here you can see there is a limitations of airflow, there is a air trapping and increased resistance. So all these things ultimately leads to difficulties in exhalation process, means difficulties in breathing process. In case of restricted lung disease, you can see the common one is the pulmonary fibrosis. There is a decreased lung compliance. I have already mentioned the lung compliance is nothing. It is the elastic property or it is the stretchability. So here in case of restrictive lung disease, there is a decrease in lung compliance, means the lungs are unable to stretch or expand properly. For the proper expansions or for proper stretching, it needs greater respiratory efforts. Means this is again dyspnea, as I mentioned. Other than this, cardiovascular cause also leads to the changes in the breathing process. Here, this process or the greatest efforts for the breathing mechanisms leads to changes in some receptors. Means here you can see this obstructive airway disease, restrictive lung disease or cardiovascular causes, they all are related with the changing pattern of breathing process. Now, so here all this increases the lung stiffness. So if the lungs is stiff, it is very difficult to stretch, right? And which ultimately activates the stress receptor. So for the stretching, it needs the activation of some receptor so that it stretches properly. Here the receptors that involves with the stretchings are pulmonary stress receptors, and it's further stimulating the process called dyspnea. Now, other than this obstructive, restrictive or cardiovascular causes, there are some other causes that's also related with this abnormal breathing mechanism or abnormal breathing process. So these are called anemia and metabolic acidosis, and in some cases neuromuscular disorders can impair oxygen delivery and ultimately affects the ventilatory function. Here, like the previous one, we have some compensatory mechanisms. So what are the compensatory mechanisms? To compensate, the body increase the respiratory rate, right? So that it will be possible to get sufficient amount of oxygen, so that it will be possible to release the waste materials. Means it needs the changes in the respiratory rate and also the changes in the tidal volume, right? And cardiac output. But if you see the conditions like prolonged dyspnea, it can lead to respiratory muscle fatigue, and if there is a respiratory muscle fatigue, there is a reduced oxygen delivery because the muscles are not properly contracting, right? So it reduces the oxygen delivery, and ultimately if there is a deprivation of oxygen, there is a high chances of lactic acidosis or metabolic acidosis, right? And ultimately leads to respiratory failure. Now see, what are the management strategies, right? So management strategies involve, the most important one is oxygen therapy, right? Other than oxygen therapy, some bronchodilators may help to get relief from this particular breathing abnormality, right? Other than this, some steroid drug like corticosteroid and diuretics also important to manage this abnormal breathing process. Now, other than this management process, another important is that may also help, that is called contributing factors. So what are the contributing factors that contributes this abnormal breathing process? These are anemia, metabolic imbalance and psychological distress. If we focus onto this particular contributing factors, we can improve our abnormal breathing process. Now see, another important process called asphyxia. So what is the features of this process? Let me continue. See, what is the pathophysiology of this? Again, like previous case, it is a life-threatening conditions. It is not a normal conditions, right? What is life-threatening? Because there is again insufficient oxygen supply and inadequate carbon dioxide elimination, right? Like the previous one. It leads to severe hypoxia. Obviously, if there is imbalance between supply and demand, there will be chances of the development of severe hypoxia and too much carbon dioxide, because carbon dioxide is accumulated into the tissue, it is not washed out. At the same time, there is, due to the changes in the pH, there is a high chances of the development of metabolic acidosis and multi-organ failure. So what is the pathophysiological basis? Like previous one, there is also the involvement of most important system in this particular process that may be affected. So these are respiratory, cardiovascular as well as nervous systems, right? See here, the asphyxia can be classified into different types, and if you see the characteristics of all those different types, these are of difference. So what are the classes? These are mechanical asphyxia, chemical asphyxia and respiratory depressions. So what is the most important features of mechanical asphyxia? Here if you see the patterns, there is a high chances of airway obstructions in mechanical asphyxia. So if there is obstructions in the airway, so the air flow or passage of a proper air flow may be altered. In case of chemical asphyxia, there are some toxic gases that preventing oxygen use. So what are those chemical gases? That is oxide poisoning, right? Other than this, respiratory depressions means there is impaired breathing. It is due to some drugs as well as neurological depressions also leads to respiratory depressions. So it means based on some characteristics, the asphyxia are of a different types. Some are called mechanical, some are called chemical, and others is respiratory depressions. Now here the pathological basis of mechanical asphyxia or other type of asphyxia, if you see the process, now you will find some differences from previous ones, and also if you see the pathophysiology of different type of asphyxia, you will find some similarities also. So what is the exact pathophysiology of asphyxia or different type of asphyxia? See here, the first one, the airway obstruction is the very common one, right, of mechanical asphyxia, right? So here, not only the airway obstructions, we can say due to airway obstructions, there is a high chances of respiratory failure, right? So what are the most important causes? The important causes are the blockage in the airway and some drugs that affect the respiratory passages called respiratory depressions. At the same time, there is a changes in the gaseous exchange mechanism due to the exposures of some important chemical like inhalation of smoke or carbon monoxide poisoning, right? So what is the effects of those? The effects is again the reduced oxygen intake. Similarly, it also causes the inadequate elimination of waste materials, carbon dioxide. Both of this leads to the developments of hypoxemia and hypercapnia. So here hypoxemia is related to the reduced oxygen intake, and hypercapnia, it is due to inadequate carbon dioxide elimination, means blood contains more amount of carbon dioxide. So what is the initial response? So initial response is the body attempts to compensate by increasing the breathing effort, right? So here increasing the breathing effort, these breathing efforts involve some muscles. These are called accessory muscles. Now another important thing is here oxygen deprivations and carbon dioxide accumulations. See, as I already mentioned, the development of hypoxemia and hypercapnia, both of this leads to cellular dysfunction. Both of this, hypoxemia means at tissue level there is a deprivation of oxygen, and hypercapnia there is a buildup of carbon dioxide. So here both the deprivation and the accumulations both affects the normal physiology of cells called cellular dysfunction. So cellular dysfunctions is mainly due to the lack of the supply of this particular gas called oxygen. Now again here, so how these conditions stimulate our respiratory receptors. Here activation of chemoreceptors in the brainstem to increase the breathing rate. Breathing rate is the one of compensatory mechanism. Here another one is, in this particular case there is a high chances of difficulty of breathing and the developments of cyanosis as well as restlessness, anxiety. It means all these features are interrelated. At the same time, all these features mainly depends on two things. One is whether the supply and demand of oxygen is sufficient or not, whether the removal of carbon dioxide is proper or not. If both of these are disturbed, they ultimately affects the whole process, right? Another important things here in this particular case is shift to anaerobic metabolism. This is also I mentioned. So when it is shifted to anaerobic metabolism, it is shifted to anaerobic metabolism when there is a less inhalation of oxygens, less supply of oxygens. So if there is a less supply of oxygens or less availability of oxygens, cells will undergo anaerobic process, anaerobic respirations. So anaerobic respirations ultimately leads to the productions of some acids called lactic acid, and ultimately leads to the developments of metabolic acidosis. So here, like other cases, the metabolic acidosis is again another important things that may develop. So here, this particular case affects different cardiac events. So what are the cardiac events that may be affected by this abnormal breathing process? So there is an effect in the bradycardia, means or heart rate. There is an effect in heart rate, means there is a slow heart rate, and it is mainly due to failure of the heart pacemaker cell. And there is a low blood pressure, and it is due to the losses of the ability to pump the sufficient amount of blood, means due to the defect in the cardiac output. Due to that effect in the cardiac output, there is a changes in the pressure value also. And at the same time, not only this, there is a high chances of the developments of irregular heartbeat, as well as there is a high chances of the developments of fluid buildup in the lung. So here all these things ultimately affects our the developments of multi-organ failure. So breathing process, normal breathing process is essential to maintain the normal partial pressure of oxygen or partial pressure of carbon dioxide. At the same time, what we have seen, when there is an abnormal breathing process, there is a high chances of the multi-organ failure. Now, Like this, what are the possible remedies to improve the ventilatory process, to improve the respiratory process? Yes, that's the most common one. The most common one you can see here from this slide, oxygen therapy. Why? Because in most of the cases what we have seen, either there is a hypoxia, there is a hypoxemia, there is a hypercapnia. So these are clinical terminology. Now our question is whether there is any process that may help to improve the hypoxia, hypercapnia, hypoxemia or others. Yes, this is called oxygen therapy. So what is the features of oxygen therapy? Oxygen therapy, it is a medical interventions that is used to treat hypoxia by delivering supplemental oxygen. By delivering supplemental oxygen to improve the tissue oxygenation and also to reduce the respiratory distress. The most important points. So what is the importance of oxygen therapy? Importance is it acts as a it helps to deliver supplemental oxygen. For what? For improvements of the tissue oxygenations. It works by increasing the alveolar and arterial oxygen levels, reducing the work of breathings. So here how it works? It works by increasing the alveolar or arterial oxygen levels, reducing the work of breathings and preventing the complications like hypoxic pulmonary vasoconstrictions, right? So what are the indications of which we can say yes, oxygen therapy is required? The indications are some respiratory disorders. So what are these? Like obstructive lung disease, pneumonia, respiratory distress syndrome and some cases pulmonary fibrosis. If these happens or the symptoms occurs that is related to this, in that particular situations we can suggest the oxygen therapy. As well as some cardiac issues like heart failure and myocardial infarctions also is involved, in which we can suggest the oxygen therapy. In some neurological disorders like the strokes or brain injury or toxic exposure to carbon monoxide poisoning, in these conditions, in these particular conditions also we can suggest the oxygen therapy. Here with other remedy process, the oxygen therapy is the most common one that may improve the normal breathing process. So here let me just brief again. In today's lectures I tried to give a brief introductions how the normal breathing process are getting affected and what is the rule of the partial pressure of oxygen and partial pressure of carbon dioxide, how these three different systems like respiratory, cardiovascular and neural systems, they altogether coordinates the compensatory mechanism of breathing. So this is what is the pathophysiology of abnormal breathing process.